Alright, so good evening everyone and welcome to our free webinar. I'm Dr. Gabriel Pascual. I'm the Chief Executive Officer of Legend Review Center. I placed second in the March 2021 Physician Licensure Exam and second also in the September 2014 MedTech Licensure Exam. Alright, kamusta kayo guys? I'm sure you have heard the news no, na lumabas na yung results ng last boards, di ba? Ayan. So of course, since tapos na yung last batch, no, it's your turn now to prepare for the board exam. That's why we're having this pre-test, no, para magkaroon kayo ng idea kung ano yung mga expect nyo ng mga questions in the next board exam. Hopefully, no, hopefully hindi na naman magbago kasi ngayong boards nakakatapos medyo nagulat tayo dahil well, di naman nagulat na expected naman guys, no. But a lot of students, no, those who were expecting easier questions, nagulat sila no na nagbago ng mga tanungan sa board exam. Although of course, kahit na ganun yung nangyari, mataas pa rin yung national passing rate natin. No, are you aware of the national passing rate? 'Di ba? Nag more than 80% siya. Hopefully by your batch, no, sa August, no, tumaas pa yan. Kasi before umabot na yan ng 85%. No, let's try to reach that. All right? And of course, you'll be able to reach that if you prepare early. That's why we have this pre-test. All right. So for this pre-test, ito po yung distribution ng scores. No? The highest score was 29. Wala po naka-perfect. Okay? Median score was 17. All right? Average was 16.96. No? So if you have that, you're in the middle. No? You're in the average. By the way, 800 plus no ang sumagot ng ating pre-test. No? To be exact, 806 as of today. All right. Let's go over the questions. First question. Female born with XX chromosomes develop ambiguous genitalia or genitals that appear male. What is this condition? The correct answer here is CAH, that's congenital adrenal hyperplasia. Okay, bakit hindi po Turner syndrome or Klinefelters? Ang Turner syndrome po, tandaan nyo guys, in Turner syndrome, your patient has a deletion of one of the X chromosomes. No? Babae dapat yan. Remember, ang babae, double X. No? Sa Turner po, one of the X chromosome becomes deleted. So, ang mangyayari po, XO na lang siya. No? And the patient would appear as a female. Okay, female pa rin yan. On the other hand, in your Klinefelter, the problem is you have an excess X chromosome. No, lalaki po ito, male po ito with an excess X chromosome. So the male would be XXY. Okay? So lalaki yan kasi may Y chromosome siya. Unlike yung Turner syndrome, na wala siyang Y chromosome, babae yan. Okay? Although may deletion nga siya ng isang X chromosome. That's why naging XO. On the other hand, congenital adrenal hyperplasia could happen to both males or females. So it's either XX or XY. Of course, kung XX yan, that's a female. Okay? Kung XY naman, that's a male. Okay? Now, what's the problem here? The problem is in congenital adrenal hyperplasia, nagkakaroon ng excess androgens, no? Excess na sex hormones. So kung babae po yung ating newborn, no? Yung excess na hormones na yan, eventually they would cause now ambiguous genitalia. Yung clitoris po ng babae, nung female na newborn, nagiging enlarged na pagkakamalang penis. Now that's your CAH, no? Congenital adrenal hyperplasia. So the answer here is CAH. Okay? So majority got this correctly, pero marami pa ring nagkamali. Okay? I think this is the first time that they ask something like this. No? Bihira sila magtanong ng mga ganitong question na medyo clinical. Okay? So let's talk about CAH. And the most common cause of CAH, that's congenital adrenal hyperplasia, the most common cause is 21-hydroxylase deficiency. Okay? 21-hydroxylase deficiency. Saan po involved ang enzyme na ito? This enzyme is involved in the production of steroid hormones. Okay? Remember, your steroid hormones are all derived from cholesterol. Ayan. All steroid hormones come from cholesterol. Okay? And through a series of enzymatic reactions, eventually, your cholesterol becomes your steroid hormones. Okay? Your cholesterol can eventually become aldosterone. Okay? Primarily, this happens in the zona glomerulosa of your adrenal cortex. Okay? Are you familiar with the adrenal cortex? Diba? In the zona fasciculata, additional enzymatic reactions convert cholesterol to cortisol. Okay, so zona fasciculata, cortisol yan, no more of your glucocorticoids. And then in the zona reticularis, additional enzymatic reactions eventually convert cholesterol to sex hormones. Okay, yan ang steroidogenesis. They have to remember this. They have to memorize this for the boards. Hindi po. No, kung pina-memorize niyo ito nung third year kayo, hindi po ito pinapa-memorize sa board exam. Okay? Ang mahalaga lang dito maintindihan niyo siya. No, maintindihan niyo na si cholesterol yung parent molecule ng steroid hormones, no? And these enzymatic reactions happen mainly in the different layers of your adrenal cortex. Okay? Now, saan papasok ang 21 hydroxylase deficiency? Titigan niyo yung diagram muna. Nasaan dyan si 21 hydroxylase? Okay? 21 hydroxylase in this diagram is your CYP21. Ito po siya. Yan, CYP21. So what do you think would happen no, if you have CYP21 deficiency or 21 hydroxylase deficiency? Can you still produce aldosterone? Yes or no? Type mo sa chat box. Pag may 21 hydroxylase deficiency ka, can you still convert cholesterol to aldosterone? Yes or no? Hindi na. So yung ating aldosterone levels, eventually babagsak yan. Okay? Can you produce cortisol? Looking at the diagram, can you still produce cortisol? No also. So ang cortisol levels mo, bagsak din. Okay? Nakuha? Ang cortisol levels yung bagsak din. Eventually, lahat ng precursors na dapat magiging aldosterone or magiging cortisol, lahat ng precursors magiging sex hormones. Ayan. So, yung patient with 21 hydroxylase deficiency, they would have decreased aldosterone, decreased cortisol, but an increase in your androgens or in the sex steroids. And yun yung magkakos ng manifestation mo. No, na ambiguous genitalia in female neonates. Lalaki yung clitoris ng female neonate such that mapagkakamalan siyang penis. Such that no, hindi ma-proclaim kung lalaki ba or babae yung neonate. Kakailanganin pa na magkaroon ng genetic testing no, bago masabi na lalaki or babae. Okay, that's your CAH, congenital adrenal hyperplasia. Please also remember na this is one of your original disorders being screened in your newborn screening. Okay? Naalala niyo pa ba yung 5 na original sa newborn screening? Siguro ang turo sa inyo 6, no? Pero actually, ang original po 5. Okay? One of the original 5 is your CAH, congenital adrenal hyperplasia. Okay? So are we clear with this? First question pa lang yun, guys. Okay, next question tayo. Which organ produces vasopressin? What is the other name of vasopressin, by the way? Anyone? Okay, good. The other name is ADH, antidiuretic hormone. Okay? Marami pong sumagot ng posterior pituitary, no? Pero actually, ang ADH or vasopressin is only stored by the posterior pituitary. Okay, what's the other hormone stored by the posterior pituitary? Ano po yung other hormone stored by the posterior pituitary? Okay, very good. Oxytocin, no? Dalawa silang stored by the posterior pituitary, ADH and oxytocin. Now, however, both of them are actually being produced by the hypothalamus. Now, ang sagot po dito is hypothalamus. Okay? Huwag kayong malilito dito, guys, no? Usually, na-associate ang ADH with the posterior pituitary, but it is actually produced by the hypothalamus. Okay? So this is your reminder to please master your endocrine glands, no? Kabisadun yung mga endocrine glands ninyo and their particular secretions. Okay? Next, best marker for risk in diabetic nephropathy. Okay, the answer here is microalbuminuria. When you say diabetic nephropathy, no, first, the affected organ here would be your kidneys. Alam naman natin to, no? A lot of diabetic patients, one of the organs being destroyed is the kidney. No? In particular po, yung glomerulus. No? Yung glomerulus ang tatamaan. Eventually, nagfe-fail yung glomerulus, okay, your albumin starts to be excreted no, in the urine. Remember, supposedly, in your normal patients, hindi po dapat nakaka-escape ang albumin sa glomerulus. Diba? But in diabetic nephropathy, nagsisimula na po mag-escape ang albumin and makikita mo na siya sa urine. No, in small amounts, that's what you call microalbuminuria. Okay? Which is a marker of risk for diabetic nephropathy. Okay? Sagot dito, microalbuminuria. Okay, next. Which lipoprotein migrates farthest from the anode during electrophoresis? So may question sa last boards no, regarding this. Okay? Maraming sumagot po ng HDL. But you have to remember, sa HDL po yung closest to the anode. No? Remember, yung anode yung positive electrode, ha? Yan. Sa HDL po yung closest to the anode, not the farthest. If we're talking about the farthest, we're actually talking about the chylomicron. Okay? So ito po yung pattern natin in your electrophoresis. Take a look at the picture. Zoom ko lang, guys. Yan. So itong positive electrode nyo, it's your anode. As you can see, ang closest po is HDL, followed by VLDL, followed by LDL, and then the farthest from the anode is your chylomicron. Okay, tandaan nyo na yung kanilang arrangement. Okay? Also, remember na ito rin yung basis for their other names. Your HDL is also known as your alpha lipoprotein. Now, for the reason that it migrates to the alpha region. Okay? VLDL is also known as your pre-beta. LDL is your beta lipoprotein. Okay? Ang natanong na before yung beta. No, beta lipoprotein is LDL. Okay? Also, please remember that aside from electrophoresis, another way to analyze your lipoproteins is ultracentrifugation. Okay? Ultracentrifugation. No, actually, ultracentrifugation po ang reference method. No, ultracentrifugation is your reference method. It would separate your lipoproteins based on density. Okay? Based on density. And based on density, ito po yung maging arrangement natin. No? Ang nasa topmost layer would be your chylomicron, since siya yung least dense. And then this is followed by VLDL, followed by LDL, and finally, the densest would be your HDL. So you would find it at the lowest portion. Okay? Next, what is the purpose of caffeine in the Jendresic-Groff method? Oh, ano pong ina-analyze natin when you do your Jendresic-Groff method? What we're analyzing is, of course, bilirubin. Okay? And nagamit natin dito is your classic diazo reaction. Classic, type ko muna guys. Yan, classic diazo reaction. So what happens here is bilirubin reacts with your diazothisulfanilic acid to form your azobilirubin. Okay? Now, in your classic diazo reaction, ang nagre-react lang po directly is conjugated or unconjugated. Ano nagre-react directly dito, guys? Conjugated or unconjugated? Okay, very good. Ang nagre-react lang po directly is conjugated. Yung unconjugated bilirubin, hindi siya nagre-react directly. Kaya siya tinawag na indirect. Okay? For it to react, no, for it to react, you have to increase its solubility. And doon papasok yung mga tinatawag natin na accelerators, no? An example of this accelerator is your caffeine. Okay? If you're using caffeine as accelerator, the method is Jendresic-Groff. So anong purpose ng caffeine as an accelerator? Your caffeine increases the solubility of unconjugated bilirubin. It solubilizes unconjugated bilirubin. Okay, huwag kakalimutan guys, na for Jendresic-Groff, caffeine. Ano purpose ng caffeine as an accelerator? It solubilizes unconjugated bilirubin. Okay? How about in your Evelyn Malloy method? Sige nga, what is the accelerator in your Evelyn Malloy? Okay, very good. In your Evelyn Malloy, the accelerator is 50% methanol. Okay, the accelerator is 50% methanol. Okay, again, agenda si Groff, caffeine. Evelyn Malloy, 50% methanol. Anong purpose nila? They increase the solubility of unconjugated bilirubin. Okay? Okay, let's continue. Microbiology na to guys. Actinomyces. No? Ito yung medyo paborito for the past boards. No? Actinomyces are blank. No? Actinomyces, remember, are gram-positive bacilli. They are branching and non-spore forming. This is one of your branching bacteria, no? Or one of your fungi-like bacteria. Aside from actinomyces, sino pa yung isang fungi-like bacteria? Okay, very good. The other fungi-like bacteria or the other filamentous bacteria is your nocardia. Okay? Actinomyces and nocardia po yung branching or fungi-like. Now, how do you differentiate this? How do you differentiate nocardia from actinomyces? So, pwede natin gawa ng table yan. Gawa natin ng table. Mabilis ang table lang, guys. Nocardia versus actinomyces. Pareho silang fungi-like, pareho silang filamentous. But how do you differentiate them? Okay, very good. You can differentiate them using their oxygen requirement. Remember, nocardia is aerobic. Nocardia is aerobic. Actinomyces is anaerobic. Okay, hindi ko na isusulat buo guys. So medyo nahirapan ako magsulat ngayon. Wala yung digital pen ko. No? Actinomyces is anaerobic. Aside from that, what is another way to differentiate them? Okay, very good. Yung acid fast nila, no? Acid fast staining nila. Nocardia is acid fast. Nocardia is acid fast. Okay. Actinomyces rather. Actinomyces is non-acid fast. Okay, huwag niyo nakakalimutan to guys, no? Sa board exam. Okay, non-acid fast. Okay, what are the other must-knows for actinomyces? Ano pa yung dapat malaman? Ano po yung characteristic na description ng colonies na actinomyces? Yung naka-encounter na ba sa inyo guys? Ano yung classic description ng colonies niya? Okay, very good. No, actinomyces have molar tooth colonies. Molar tooth colonies. Okay? And aside from that, they also produce what you call your sulfur granules. Now, actinomyces produce sulfur granules. Okay? Huwag kakalimutan to guys, no? Dalang board exam na yan. Paborito talaga nila si actinomyces. Any questions so far? All right, next. Babes Earns granules. These are produced by what bacterium? Okay, so the answer here is Corynebacterium diphtheriae. Okay, wag kakalimutan guys, no? Your Babes Earns granules are produced by Corynebacterium diphtheriae. Okay? Ang mnemonics namin dito, di ba, Corynebacterium. Ang mnemonics namin dito sa legend, Corynebacterium, Babes Earns. Tandaan nyo, ang corny mo, babes. No, ang corny mo, babes. No? Corynebacterium diphtheriae, that's your Babes Earns granules. How about sinabi ko na. How about your Mycobacterium tuberculosis? Oh, okay. For Mycobacterium tuberculosis, the metachromatic granule would be your Much granules. Okay? This would be your Much granules. How about for Yersinia pestis? Ano naman po ang metachromatic granule ng Yersinia? Okay, Yersinia pestis naman po, bipolar bodies. So Yersinia pestis, bipolar bodies. Okay? Huwag kakalimutan guys. The majority naman tumama dito. Alright, next. McFarland standard. 0.5 McFarland standard is equivalent to, this is equivalent to 1.5 times 10 raised to 8 CFU per ml. Now, we use this 0.5 McFarland when we are preparing our inoculum. Dapat yung inoculum ninyo, yung turbidity niya, should match your 0.5 McFarland. If pag nag-match yan, no, if nag-match yan, this would be equivalent to 1.5 times 10 raised to 8 CFU per ml. May paborito ang tinatanong to sa boards, guys. Okay? Actually, everything about your Kirby Bauer, you really have to know. Okay, usually meron mga 2 to 3 questions sa Kirby Bauer talaga. Okay? So ayan ulit, your 0.5 McFarland is equivalent to 1.5 times 10 raised to 8 CFU per ml. Ang isa pang paboritong tinatanong dito guys is how you prepare the 0.5 McFarland. Okay? So how do you prepare the 0.5 McFarland? Ito po yun. Ayan, you add 0.5 ml of 1.175% barium chloride and 99.5 ml of 1% sulfuric acid. Okay, medyo memory work lang ito, no? So again, 0.5 ml of 1.175% barium chloride and 99.5 ml of 1% sulfuric acid. That's how you prepare your 0.5 McFarland. Okay? Next, identify the following. Ito yung sa mga nakakagulat na questions last board exam. Okay? So the picture here is actually your miracidium. Okay? Your miracidium, no, is produced by your nematodes. No, pag nag-hatch yung egg ng mga trematodes, ang nare-release po is your miracidium. Okay, like for example here in this life cycle, now what you can see here is the life cycle of Phaseolopsis busci, one of your trematodes. Okay, yung egg ng Phaseolopsis busci, okay, ang mare-release po niyan is yung miracidium. No? And it is the miracidium which should now infect the first intermediate host, which is your snail. Okay, miracidium. Where do you find your coracidium? Balikan lang natin question. Sino po yung nagpo-produce naman ng coracidium? Anyone? So kung miracidium trematode, okay, sino naman ang nagpo-produce ng coracidium? Clue, it's actually one of your cestodes or tapeworms. Sinong tapeworm yun, guys? Okay, very good. Corasidium po is produced by your Diphyllobotrium latum. Okay? Pag nag-hatch yung egg ng Diphyllobotrium latum, Corasidium yung lalabas. Okay? How about your oncosphere? Ano yung other name ng oncosphere? Oncosphere is also known as your hexacant embryo. This is also known as your hexacant embryo. Oh, sino naman na nagpo-produce ng oncosphere or hexacant embryo? Okay, actually, the rest of the cestodes, the rest of the tapeworms. Nakuha ninyo? Ang rule dyan, lahat ng tapeworms, lahat ng cestodes, they produce your oncosphere. Yung egg nila contains the oncosphere. The exemption to the rule is dilatum. Okay? Ang dilatum, ang laman ng egg po is your corasidium. Okay? And this is the life cycle of your trematodes. Miracidium infects your first intermediate host, which is your snail. Inside the snail, maraming stages na mangyayari dyan. No? Yung mga stages sa loob niyan, depende yan sa species. Okay? Ang mahalaga dito, alam niyo na ang last stage po is the cercaria. No? Ang cercaria po yung magsiswim out of the snail. Okay? Eventually, this is cercaria which would now infect the second intermediate host. And then inside the second intermediate host, the cercaria would now transform to your metacercaria. Okay? So ano ang mode of transmission natin dito? Ang mode of transmission natin dito is ingestion of the second intermediate host. Okay, and what is the infective stage? The infective stage would be your metacercaria. Okay? That is if we're talking about most of the trematodes. Kasi yung mga schistosoma nyo, yung mga blood flux ninyo, may iba yung kanilang life cycle, iba yung kanilang mode of transmission. And that would be for some other lecture. No? Hindi na natin kayang discuss na ngayon. No? Maubusan tayong oras. Alright, next question. Characteristic odor of Proteus. Ito guys, kailangan kabisado nyo yung mga odors. No? So si Proteus po siya yung napoproduce ng burnt chocolate odor. Okay, burnt chocolate odor. Sino naman yung nagpo-produce ng grape-like or corn tortilla-like odor? Type na sa chat box. Okay, very good. That would be your Pseudomonas aeruginosa. Bleach-like odor. Sino naman yung bleach-like? Okay, very good. Bleach-like, Echinella, rodents. And then sino naman po yung fruity odor resembling apples or strawberries? Ito hindi nyo aakalahin eh. Okay, very good. That's your Alcaligenes fecalis. Diba? Sa pangalan niya, fecalis, akala mo mabaho. Diba? Pero, ang characteristic odor niya is actually a fruity odor. Okay? Ito po yung table natin ng mga characteristic odors. You can take a picture of this if you want. Okay, pwedeng screenshot guys. Try to memorize this, no? Or at least malang ma-feel familiar sa inyo. Okay, kung ako sa inyo, no? Isulat niyo na po ito sa index card. Sulat niyo na sa index card. And then, habang nag-aaral kayo ng bacteriology, no? Kung intern man kayo ngayon, nagbabasa kayo ng libro, whatever, ganyan. Pag may na-encounter kayo na additional na odor, isulat niyo sa index card. Okay, ganun din yung mga microscopic characteristics, yung mga cultural characteristics, isulat nyo na agad lahat yan sa index card. Para pagdating na mismong review, no, pagdating na mismong review, no, madali nyo na balikan yung mga index card. Okay? Next question. CM na po ito. High protein intake causes blank urine. No, very basic. Now, remember, your high protein intake causes acidic urine. Okay? Acidic po yan. Anong examples ng nagkakos ng alkaline urine naman? When it comes to diet, ano magkakos ng alkaline urine? Yun, very good. Gulay. Okay, mga vegetables, no? Alkaline urine. Okay? Ayan. Ang isa niyo tatandaan na ang isa pang tatandaan na nagko-cause ng acidic urine is your cranberry juice. Huwag niyo kakalimutan, guys, no? Cranberry juice causes acidic urine. Okay? Cranberry juice is actually used as a home remedy, no, for UTI. And it causes acidic urine. Okay, next. How do you correctly evaluate urine turbidity? Actually, hindi lang ito urine turbidity, also urine color. No? How do you evaluate urine turbidity? The answer here is against a white background. No? Yung urine po, itatapat ninyo against a white background. Okay? Next, more representative measure of renal concentrating ability. Ano sagot dito, guys? Maraming sumagot na specific gravity, but this is actually osmolarity. Okay? This is according to Stratinger. Okay? Next, each kidney contains approximately how many nephrons? Makita ninyo ito sa chapter ng renal physiology or renal function sa Strassinger. Okay, so remember, each kidney contains 1 to 1.5 million nephrons. And that's per kidney. Ganun siya kadami. Okay? And these nephrons can never regenerate. No, habang tumatanda tayo, may mga nasisirang nephron, pababa ng pababa yung number na nephrons natin. Okay? Huwag kakalimutan yung number guys. No, 1 to 1.5 million per kidney. Next, correct way of adding reagents together. Usually mga ganitong tanong sa CM talaga. Okay, so the correct way is adding acid to the water. Not the other way around. No, huwag niyong pagbabalik rin guys. Acid to water dapat. Okay? Alright, next, hematology na po. What is the average diameter of RBCs? So the answer here is 7.2 micrometers. Kung hingan kayo ng range, ano ang sagot nyo guys? Ano ang normal diameter ng RBCs kung range ang usapan? Okay, very good. No, kung range pang usapan, madali lang, 6 to 8 micrometers yan. Pero ang tinanong last boards, single value. So anong sagot? 7.2 micrometers. Okay? Next, which of the following is frequently associated with uremia and is also known as an echinocyte? Okay? Ang associated po with uremia is your Burr cell. Okay, that's your Burr cell. Okay, this is also known as your echinocyte. Okay? Turo ko lang sa inyo guys yung palatandaan ko dito. Okay? So how do I remember this? Sulat mo yung Burr. Ayan. Tapos, huwag kayong kukurap guys na magmamagic ako. Ayan. I-connect natin yung dalawang R. Ano na yan guys? BUN na yan. Ano bang tumataas sa uremia? Ano bang tumataas sa uremia? Ang tumataas sa uremia, BUN. Di ba? Para maalala niyo yan, no? Ganito yung gawin ninyo. I-connect yung dalawang R para magmukhang letter N. And ang tumataas sa uremia is your BUN. Okay, that's how I remember this. Yung target cell ninyo. Saan associated usually ang target cell? Kung may tatanong kayong isang condition for your target cell, what is that condition? Your target cells are associated with thalassemia. Okay, madaling tandaan. Target cell, thalassemia. Okay? Alright. So we have here a list of your must-know abnormal RBC morphologies. Okay, you can take a screenshot again of this. Okay, again, remember your echinocytes or Burr cells is associated with uremia. Okay, acanthocytes or spur cells on the other hand, ang tatandaan nyo dito guys, a beta lipoproteinemia. Okay, for target cells or podocytes or Mexican head cells, I want you to remember thalassemia. Okay, madaling tandaan, di ba? Target cell, thalassemia. Okay, spherocytes, you would see this of course in hereditary spherocytosis. But other than that, please remember G6PD deficiency. Okay, microspherocytes on the other hand are associated with burns. Okay, teardrops are the cryocytes. You would see this in your extramedullary hematopoiesis. Now, basta meron kang extramedullary hematopoiesis, you would see your teardrop cells. Okay? An example of this would be in myelofibrosis and also in myelophthic anemia. Okay? Sickle cells, obviously, you would see this in sickle cell anemia. Okay? Yung helmet cells yun naman, horn cells or keratocytes, you would see them in MAHA. Ganon din yung schistocytes ninyo. You would also see them in MAHA. Okay? Hindi ko nagkikwento paano yung na-form. Na-for now, tandaan nyo muna. But may kwento yan guys kung bakit nagkakaroon ng ganyan sa MAHA. Stomatocytes or mouth cells, you would see them in hereditary stomatocytosis. Okay? Ang hindi po nabanggit dito is Rh null phenotype. Dagdag ko lang po. Okay? Your Rh null phenotype in your blood banking, no, is also associated with your mouth cells. Okay? How do I remember this? May palatandaan din ako dito, guys. Di ba null? Yan, ganito yung susulat yung null, no? Letter N, letter U, letter A, letter L, tapos isa pa letter L. N-U-L-L. Tapos bilugan nyo, guys. Anong RBC na yan? Anong RBC na yan? That is now your stomatocyte, no, or your mouth cell. Again, it is associated with your Rh null syndrome. Okay? Erythrocytes or valocytes, these are seen in the effects of your RBC membrane proteins. Okay, semilunar bodies, half-moon cell or crescent cell, you would see this in malaria and hemolytic conditions. Okay, next na tayo. Identify the abnormal RBC shown in the picture. No, ito separate po na question nung last words. Okay, so ano yung nasa picture nyo? Boring ko lang yung nasa slide. Yan. So what you can see here in the picture is your burst cell. How do you know this is a burst cell? Not an acanthocyte. Anong difference ng burst cell versus your acanthocyte? Sino po yung may even, rounded projections? Sige nga. Sino yung may even, tapos rounded, tapos regular projections? Ayan, or uniform. All of this describe your burst cell. Okay? And this is also reversible. Huwag niyo kakalimutan guys, na ang burst cells ninyo, reversible. Pag nawala na yung uremia ng pasyente, pag nawala na yung uremia, nawawala din yung burst cell. Okay? In contrast, yung acanthocytes niyo, irregular yung projections, tapos spiky, sharp. No? Hindi tulad ng burst cell na rounded. Okay? Yun yung laging yung nakakalito, no? Burst cell versus your acanthocyte. Right? Next. Ito yung actual na picture last boards. Which of the following is represented by the first peak in this picture? Ano muna yung picture na to guys? Ano ba tong picture na ito? Have you encountered this before? What do you call this picture? Or what do you call this graph? Okay, very good. This is actually your WBC histogram. Okay, this is your WBC histogram. Anong plotted? Ano naka-plot dito sa x-axis? Based on the unit of measurement. O, nakalagay yung femtoliters. Ano naka-plot sa x-axis? Okay, very good. Ang naka-plot sa x-axis is the cell size. So as you go to the right, no, pag papunta ka na papunta sa right side, palaki ng palaki yung cells mo. No? As you go more to the right, the larger are the cells. Now, ano naman yung naka-plot sa y-axis? Ang naka-plot sa y-axis, yung number ng cells. No? Cell number naman itong nasa y-axis. Okay? Now, what is represented by the first peak? If you're going to compare the cells here in the first peak versus the cells in the other peaks, how would you describe them? You would describe the cells as being small. Diba? Sila yung smallest actually. And sino ba yung mga smallest yung na WBCs? Sino yung smallest na WBC? Okay, very good. No, ang smallest na WBC would be your lymphocyte. So you would expect that they are in the first peak. Alright, next. Hemoglobin molecule is comprised of, ano po ang composition ng hemoglobin? Remember, hemoglobin is heme plus globin. No? Apat na heme, apat na globin chains. No? Apat na heme, and then apat na globin chains. Okay? So anong ratio ng heme to globin? Ang ratio ng heme to globin is 1:1. Okay? One is to 1. Alright, next. Ito sa ISBB na to, guys. Ability of a single cytokine to alter the expression of several genes. The answer here is pleiotropy. Or, yeah, ano to guys? No? Terms lang ito. No? May mga definition na ganito na paisa-isa na tinatanong sa ISBB. Okay, next, FFP is used to treat the following except. What is FFP? Your FFP is your fresh frozen plasma. Can it be used to treat DIC? Yes. No, of course. No, sa DIC, one of the problems is lahat ng ating coagulation factors nako-consume. So can you give FFP? Yes. No, kasi lahat ng coagulation factors present sa FFP. Can you give this to patients with liver disease? Yes also. Why? Kasi po sa liver disease, lahat ng coagulation factors bumabagsak din. Diba? Kasi most of the coagulation factors, they are being produced by the liver. So to replace this, we can give FFP to the patient. Okay? A vitamin K deficiency. Bakit nagbibigay ng FFP? Ganun din, no? In vitamin K deficiency, nagkaka-deficiency ka ng coagulation factors. Particularly, what group of coagulation factors? Okay, that would be your prothrombin group, your vitamin K dependent group, no? Factors 2, 7, 9, and 10. One of the reasons bakit nagkaka-vitamin K deficiency is when you give warfarin. Okay? Warfarin inhibits the production of factors 2, 7, 9, and 10. So one way to treat this is to give FFP since FFP would contain all of the coagulation factors. Mare-replace na sila factors 2, 7, 9, and 10. Lahat sila kailangan ng vitamin K for their production. Okay? Can we use FFP to treat your ITP? ITP is idiopathic thrombocytopenic purpura. Anong main problem dito? Coagulation factors ba ang main problem? Tingnan niyo yung pangalan guys. Anong bagsak dito sa ITP? Okay, ayan o, thrombocytopenic. No, may thrombocytopenia yung patient. Platelets po yung bagsak. So may platelets pa bang FFP? Wala na. No? So you cannot use FFP to treat your ITP. Ako nyo, the answer here is ITP. Ayan, except po ang tinatanong by the way. Ha? Okay, next. Red cell phenotype of an individual in routine forward and reverse grouping with the genotypes small h, and AB. Homozygous small h siya. Tapos AB. Ano magiging phenotype nyo guys? Okay, so the answer here would be type O. Your patient would be seen as type O. Bakit na magiging type O? Remember, for you to produce your A antigen and your B antigen, you have to produce your H antigen. No, H antigen po yung precursor ng A at precursor ng B. Okay? And for you to produce your H antigen, kailangan mo ma-convert sa precursor substance to H. Okay? And you're only able to do that if you inherit at least one capital H gene. Okay? So either homozygous capital H ka or heterozygous ka na H. No? Kapag homozygous ka na small h, you are not able to convert the precursor substance to H. Therefore, wala ka ring A, wala ka ring B. You would now appear as type O. And what do you call this phenotype? This is what you call your Bombay phenotype. Ang Bombay ninyo, magmumukha siyang type O. Pero naging type O siya kasi po wala siyang H antigen. Nakuha nyo? Okay, this is actually your Bombay phenotype. Okay, next, which type of hypersensitivity reaction involves immune complexes? Okay, immune complexes po, pag may involvement ng immune complex, that's your type 3. Now, ang mnemonics natin dito, huwag niyo kakalimutan guys, acid. Okay? Acid. Type 1 is your anaphylactic reaction. Type 2 is cytotoxic. Type 3 is immune complex mediated. And then type 4 is your delayed type. Okay? Acid. Alright? So ito po yung table natin ng hypersensitivity reactions. You can take a picture of this. Ang isang paborito tinatanong sa boards dito guys, yung mga examples. Bibigyan kayo ng condition tapos tatanungin kayo ano yung associated na hypersensitivity reaction. Okay, for example, SLE. Anong type na hypersensitivity guys ng SLE? SLE is mainly type 3. Ayan, mainly type 3 siya. Okay? Next, which of the following is correctly paired? Nung tinanong to sa boards guys, okay, tatlo yung tamang sagot. So southern blot, DNA, tapos northern blot. Ano dapat ang partner ng northern blot? RNA, di ba? Anong mnemonics nyo dito? Naalala nyo yung mnemonics dito? Di ba mnemonics dito? Snow, drop. Yan. So southern blot, DNA, northern blot, RNA. So sa choices dashboards, merong southern blot DNA, tapos may northern blot RNA. Dalawang beses na lumabas pa sa choices yung northern blot RNA. Okay? Ayan. So ano sasagot niyo dito kung sakali? Kung ganun yung tanong ulit. Well, siguro kung ako yung tatanungin dito guys, kung ako yung estudyante, I would just go for the southern blot. Okay, southern blot DNA. Okay? Ganun talaga yung board exam, no? Imperfect exam ang boards, guys. No? May mga typo, minsan yung mga choices mali-mali, minsan walang tamang sagot, mga ganyan. Okay? We really can't do something about it. HTML din na, guys. Ito. One of the memorable questions in our for our board takers last board exam. In writing a research paper, the acknowledgement section should be placed where? Ayan, after the title po. Okay? So may mga ganitong questions guys, no? Sa HTML, actually anything under the sun can be asked. No, dati nagtatanong sila ng epidemiology, ngayon nagtanong na sila ng research. No, hindi ko alam kung ano yung next nila itatanong sa HTML. So expect anything. Expect anything talaga sa HTML, guys. Okay? Next, reference laboratory for HIV testing. This is your San Lazaro Hospital or your SACA laboratory. Okay, ito po yung listahan natin ng mga reference labs. Usually talaga may one or two questions dito. Hindi nawawala to guys. Okay, so make sure you memorize the various reference laboratories. 1 to 2 questions po ito. Okay? Hindi ko na isa-isahin. Next, caused by friction against a rough surface. Ito, a question ito regarding physical injury. O, natanong din sa istopat. Pagka caused by friction against a rough surface, this is your abrasion, gas-gas. Okay? So ito po yung mga iba't ibang terms natin when describing wounds. Okay, by the way, when say open wound, ibig sabihin po nito, may break sa skin. Abrasion it is an example of an open wound. Okay? Another example is avulsion. Okay, pag sinabi avulsion, you have a partial or complete tearing away of the skin. Okay, ito yung tinatawag na tuklap sa Tagalog. Laceration, you have torn or jagged wounds. Okay, punit. Kumbaga, no, punit. Incision, this is caused by a sharp-edged object. Hiwa. Hiwa naman ng incision. Okay, then you also have puncture, which is caused by a sharp object. And then you also have amputation, which is complete na detachment ng isang limb or part of a limb. Okay, may mga ganitong tanungan na rin sa histopad. Now, kung may open wounds, syempre, may mga closed wounds din. Pag sinabing closed wounds naman, the skin would remain intact. An example of this is your contusion. Okay, contusion or bruise. Sa Tagalog, basa. Okay? So this is caused by a blunt trauma causing pressure damage to the skin and or the underlying tissues. That's your contusion. Okay? Now, if this is filled with blood, ang tawag naman doon, hematoma. Okay? Meron din tinatawag po na seroma, which is fluid-filled area. And you also have your crush injuries. Again, these are all closed wounds. Okay? Yeah, next question. Which of the following components of your papaniculaw stain stains nothing? Doon sa classic na papaniculaw, guys, may isang stain doon na walang ginagawa. Sino yun? That's your Bismarck brown white. Kaya po, sa mga newer formulations ng pop stain, tinanggal na po yung Bismarck brown white. Okay? So what are the components of your pop stain? Yan, your routine staining procedure. This is the routine staining procedure used in your cytopathology lab. The classic form involves 5 dyes. No, these are your hematoxylin, which is your nuclear stain. OG6 are your counter stain. Eosin azure, which is also a counter stain. Okay? Like Bismarck brown white, siya po yung walang sinestain. As in useless. That's why it is being omitted in present day formulations. Okay? Pakitandaan po yung components ng pop stain. Okay? Last question na to guys. In expanded newborn screening, which of the following is not included? Ang hindi po kasama is your neonatal diabetes. Okay? Yung CAH nyo, G6PD deficiency and congenital hypothyroidism, lahat po nito part ng original 5. No? Na siniscreen sa newborn screening. By the way, anong RA yun? Anong Republic Act number yun? Yung nag-mandate ng newborn screening. Kabisado niyo pa ba yung mga RA? Okay, very good. This is RA 9288. Okay, RA 9288. No, originally 5 yan. And then, ayan, originally 5 yan. And then, through a DOH memorandum, eventually nadagdag po sa MSUB. Kaya naging 6. Okay, so from 5, naging 6. And then, eventually, nagkaroon na rin ng expanded newborn screening. So from the original 6, naging more than 28 na po siya. Okay? Naging more than 28 na. Alright? Ito po yung listahan. You will find this in the DOH website. Okay? Kahit isa-isa nyo po ito, wala pong neonatal diabetes dyan. Okay? Kailangan bang i-memorize yan? Hindi po. No, wag nyo nang i-memorize ito. Ha? Ang i-memorize nyo na lang yung original na 6. Okay? Well, original 5 na naging 6. Okay? Pero yung iba dito, kahit wag na. Sayang lang sa space sa utak. Okay? And that's it for our pretest ratio. Kamusta yung scores niyo guys? May idea nakarami ba kayo ng tama dito or maraming mali? Ayan. May natutunan ba tayo this evening? Okay lang 'yan, kaya nga tayo may pre-test, 'di ba? Kaya tayo may pre-test para may baseline kayo, 'di ba? Hindi natin ine-expect na at this point kabisado niyo na lahat kasi imposible talaga 'yun, 'di ba? Kaya nga may review. Ang mahalaga guys, may self-awareness tayo. Alam natin yung baseline natin and then from there, we improve. Okay? Pataas na ng pataas dapat, 'di ba? Okay. Ayan. So after this, we'll be releasing the scores. And congratulations po dun sa mga matataas ang score. If you got a high score, keep it up, but don't relax. No, don't be too confident. No, magbasa pa rin na magbasa. Okay? Of course, yung mga mabababa yung scores, no, you know what to do. Okay, at least alam niyo na yung baseline ninyo. Okay?